Good afternoon and welcome everyone to the last of 6 business information and listening sessions presented by the Wyoming Business Council. My name is Warren Appel. I'll be your facilitator today. We're going to cover a quick few housekeeping matters, and I'll turn things over to Josh to talk about our agenda and panelists for this session. Written questions may be submitted using the Q&A function on the webinar toolbar. We will share these with the panelists as time allows. Please do not submit questions via the webinar chat box. We are trying to track those, get responses out to everyone who asked them, and they do get lost in the chat box. Individuals wishing to speak or ask live questions of our panelists should use the raise hand feature on the webinar toolbar. We will call on you as time allows. Please keep your microphone muted at all times when you are not speaking and keep background noise to a minimum. This is a plight for everyone on the call, of course, but also helps ensure we have good audio on our recordings. And yes, we are recording today. We will make this recording, as well as those from the other 5 sessions, available on our website, wyomingbusiness.org, as soon as possible. With that, I will hand you off to Wyoming Business Council CEO Josh Durrell to introduce our speakers and agenda.
Great, thank you, Warren, and thank you all for joining in this afternoon, or this noon time, I should say. As somebody mentioned earlier today, this is a pretty exciting day because many of these orders that you've been working under over the last few weeks have now been relaxed a bit. And this webinar is really intended to help understand those orders, what those relaxations are, and how to function within them. And more than anything, to provide you an opportunity to ask questions. And, you know, we've brought in a number of great folks to do that. But what I want to really stress today is that, you know, we want to help you understand the balance between lives and livelihood and make sure that you understand the logic behind some of these relaxations, why some were not relaxed more and why we've put those in place, as well as help you function and move forward in this limited capacity so that you can begin to serve customers again and help your business through this particular crisis. We've got a number of folks here. Warren, if you want to jump to that next slide, we'll take a quick look at those folks that are panelists here. Stephanie may be able to join us today. I'm not sure, but I know Stefan Johansson, the Deputy Director of the Wyoming Department of Health, is here. We have Sharon Bennett from the Wyoming Board of Cosmetology, and we have Roxanne O'Connor from the Department of Family Services to talk through each of these different orders and how they've been relaxed. Again, we want to make sure that everyone understands that more than anything, we want to provide some good information so that you're able to move forward as best you can, and also to provide you that format to ask some questions. Taking a look at the agenda, one of the things that's really important is keeping that idea of public health in the front of our minds and making sure that we realize that this is still a public health issue, and we really want to obviously work and begin to ramp up our businesses again, but having the public health in the front of mind is really important. And so to do that, we're going to look at the metrics that are driving our decisions, because it is going to be data driven. Businesses that are still open, we're going to look at those. We're going to take a look at how Order 1, the relaxation, affected childcare, restaurants and dining, and gyms and fitness. And then we'll take a look at Order 3, which relaxed some of those restrictions on personal care services. And then, of course, there is another area that I'm sure many people are excited to understand and know how to work through that system is the variance or exception process, which could possibly allow your business to have a specific exception to one of those rules, or countywide variance on that. With that, I did want to jump in and have Stefan talk a little bit about these health metrics, because again, these are the things that are driving it. It's data driven. This dashboard is backed with data. Stefan will take a deep dive into these and help everyone understand how we're making these decisions. With that, Stefan.
Thank you, Josh, and good afternoon, everybody. Really appreciate you all joining the call. First and foremost, I want to thank Josh, Warren, and the team at the Business Council for arranging these webinars. They've been hugely helpful, hopefully for the participants, but certainly helpful for us in the Department of Health to get some feedback, get some questions, kind of see what some of those common themes are of areas of the orders that might be misunderstood, or areas that need further clarification from our office. So thanks, Josh, to you and the whole team for setting these up. And secondly, like I said, thanks to all the participants for joining and taking time out of your busy schedules to work with us and participate with us on this back and forth. And you know, we're all a team in Wyoming, and we know it's been a frustrating time, but the more we can communicate in a format like this, I think the better. So without any further ado, I'll jump in to describe some of these metrics. And before I get into the specific metrics that you see on your screen, I just want to let everybody know that these metrics and others that you might hear about, we at the Department of Health are looking at these on a statewide basis to see how the state is performing with regards to COVID-19. But we're also looking at these on a county by county basis in more granular detail for each county, because we know that no county is experiencing the exact same thing when it comes to COVID-19 outbreak in our state. We have some counties that have far more cases, more positive cases, more hospitalizations than others, and some counties that really don't show any burden yet, at least in terms of having cases that have been diagnosed as positive. So we know it's not really a one-size-fits-all approach to look at the state as a whole and say that the statewide numbers are indicative of Weston County or Lincoln County or Natrona County, and so we're very sensitive to those differences. The second thing I'll mention before we dive into the detail is that we are looking at these both on a statewide and a county basis holistically as opposed to individually. These are all very important metrics in and of themselves, but when it comes to how they inform decision making for the Department of Health, for the governor, and specifically as it relates to provisions of the public health orders with restrictions and closures, there's no one metric here that will tie directly to one of those decisions. So we really all have to look at these as a whole, look at them somewhat impressionistically of how the state or how a particular county is doing with regards to COVID-19. So that's very important to remember. And what it really tells us in the Department of Health and the governor's office is how much risk we're willing to bear when it comes to easing restrictions, or frankly, when it comes to potentially in other areas having to put additional restrictions in place. We hope that that's not the case in the days and weeks to come, but it's certainly possible depending on the spread of the virus. And last thing I'll mention here is we don't know, nobody knows around the state, around the country, internationally, we don't know a whole lot about the virus. There's not a lot of evidence, a lot of data out there. It's getting better day by day, but when it comes to the biology of the virus, the transmission rate, the incubation period, all of that information is very initial. So again, it really causes us to have to take these metrics holistically, and because we don't have a depth of science behind the COVID-19 virus right now. So I'll jump into describing these metrics in just a little bit of detail so you understand kind of how we're grading them and what we're looking for. And the first is really the big one, and that's the number of new cases. And we obviously want this to decrease over time. And the way we're measuring that is the daily number of cases that we'd like to see decline for multiple weeks. You've probably heard in other states and in the media, 14 days, 21 days, 28 days. And in Wyoming, with so few people and so few observations when it comes to data, we're really looking for a multi-week sustained reduction in the daily number of cases. That is the only metric you'll see here as of this week, as of April 28th, that we're grading as concerning or in red color here. And that's because at the beginning of the week and really over the weekend, we did see a spike of some new cases across the state. And that causes concern for what could potentially lead to clusters or additional outbreaks. But underneath that metric, you'll see kind of some subcomponents of those positive cases. And the first one is the percent of positive cases that are attributed to community spread. Give you a little bit of a description of what that means. When someone is diagnosed from a COVID-19 test as having the virus, our team of epidemiologists at the Department of Health do what's called investigation and contact tracing. And what they try to do is try to determine where that person might have contracted COVID-19 and really trying to see where was the direct exposure or a known contact with another COVID-19 patient. And many times we're able to make that determination, but sometimes we're not. And when we can't do the contact tracing to tie it back to a known contact or a direct exposure, it is attributed to what's called community spread or community transmission, meaning that we know we don't know where it came from with this particular person, but we know it's spreading in the community. And we'd like to see this percentage maintain or decrease on that same multi-week period that I mentioned on the number of new cases. And last in this bucket that you see on the left-hand side of your screen is the percent of all tests that come back positive. And you'll also see we're grading this yellow right now as stabilizing because Wyoming, in addition to a few Mountain West states, we look better than some of our partners in the rest of the country, some of our other states throughout the country, where out of our total tests, we're seeing about a 4.5% positive rate. So 4.5% of all of our tests are coming back positive. And we want that to also maintain or decrease over time. The next bucket that you'll see on the right-hand side of your screen is kind of tangentially related to the virus metrics, and that's our hospital capacity or our healthcare system capacity. Since we do have limited data and evidence and knowledge about this virus, one of the things we have to do as a state and as counties and as the Department of Health is to monitor our hospital capacity so that if we do see a surge in the number of cases, we want to make sure that our hospitals and our healthcare providers can handle that. So our hospitals work very well with us to report these metrics that you see on the right-hand side of your screen on a daily basis. We collect each one of these daily from the hospitals. And we start with the total COVID-19 admissions reported by hospitals. So how many COVID-19 patients do you have in the hospital? We get that on a daily basis. And it's also been stabilizing over the past week and a half or so, where we're not seeing a dramatic surge on our healthcare system or our hospital system, which is very good, but we want to see that continue to reduce. And then kind of underneath that, we look at our total hospital bed availability across the state and on a county or hospital by hospital basis, in addition to the total ICU bed availability. And the reason for these two is because, as you may have heard, there are some populations, for example, the elderly, those with underlying medical conditions, that seem to be more susceptible not only to the virus, but also susceptible to additional complications related to the virus. So potentially needing hospitalization or even needing ICU, intensive care unit level of care. And so we want to see all of these continue to stabilize. And if we hit that multi-week period, we really want to see this report card start turning more yellow and green as the days and weeks unfold. And that's really what's going to inform us on the logic of and the administrative actions of easing restrictions or keeping restrictions in place. I know we'll have a lot of questions about these, and we're happy to answer those towards the end of the webinar. But Josh, I'll leave it there so that we can move on to the next topic.
You bet. Thanks, Stefan, and appreciate that, and appreciate the work you guys are doing to kind of keep track of that data and do your best to limit the spread of that. Let's jump into the next slide, which really talks a little bit about what businesses have been open and could have been opened over the last few weeks. And one of the things that we've noticed in these webinars are some questions from business owners who maybe got some conflicting information or got some incorrect information out there, and maybe could have been open during this time. And so I really want to stress that reading the orders carefully to see what the restrictions are and how they might apply to your business is important. Reaching out to your county health officials to understand, to help you out with the classification is important. The idea of essential or non-essential personnel, those are only relevant to childcare providers in our orders. You might hear a lot about essential businesses, essential personnel, and things on the national news that just don't apply to Wyoming businesses because of the way we structured our orders and the fact that we have not been as restrictive as many states. And so because of that, we just want to impress upon everyone that there are orders that are, it may be a little tough to read sometimes, but it's important to make sure that you read them at the link that I've got here on this page that will be shared with this particular, the slides of this webinar, because it's really, really critical that you read them for your business and not rely on what you might have heard on a national news story or what you've heard from your friends or neighbors, because frankly, we're hearing some misinformation out there, and that can be really bad for your business. So please take a look and try to understand how they affect your business in particular, and take those those words from the horse's mouth, so to speak, rather than those from your maybe people in your community. Along those lines, what we've wanted to do at the Wyoming Business Council is make sure that businesses that are open have a format to put it out there and let people know what their service offerings, how they may have changed, what their hours have changed, what kinds of restrictions they might have, and just making sure that people know what is open in your town. And so if you get a chance, please go to wideopenwyo.org and take a look at that. And if you have a business or you're a business owner, please go to the top right of that and add your business. Take a look and see if it's there. If it is, great. Some chambers of commerce and Main Streets and folks like that have put some of these together and sent them to us for preload. But if you'd like to make sure your business is up to date and current, please go to that website and do that in the upper right-hand corner. We also suggest, right now is obviously an important time to keep your social media channels and your Google listings up to date on your service offerings and hours. We've got a slide here that just shows one of the many informational sources that can provide you some good tips and tricks on how to get through this COVID crisis and make sure that your business is running in the best way it can. We know that there are going to be challenges. We know that even if you're allowed to be open, that many customers are not going to be shopping as freely as they were before. And so we realize that you're going to need some resources. And this is one that our Main Street manager, Linda Klink, found a week or so ago and was able to share with us. And we want to share with you. It's from this is from a southeastern state, and it's got a number of really good tips for businesses, whether it be retail, service-oriented, leaders of your community, to really help make sure that your business runs the best it can in these times. So please take a look at that if you get a chance. And more than anything, keep your head up and look around at the outside and learn from your community and learn from these informational sources on how to keep your business running well. Let's take a deep dive now into really the reasons that we want to bring this webinar to you and what we want to show you today. And again, that is really all about what is changing today. And May 1st is a pretty exciting time for many businesses. We're going to talk a little bit about childcare. We're going to talk about restaurants and dining, gyms and fitness centers, those personal services, and of course, go through that variance and exception process. And to kick us off with childcare, we have Roxanne O'Connor here to talk a little bit about what's changing under Order 1 as it relates to daycares. Roxanne?
Good afternoon. Thank you, Josh. Thank you, Warren. I echo Stefan's praise and appreciation to you for coordinating and leading these webinars. They've been incredibly informational to us. Now we know a little bit more of where our questions are at and how we can better serve childcare facilities, which is ultimately a huge priority for us, especially right now. So it's been very helpful for us, and I know it's been helpful for many members of the community, many childcare facilities. So we're really happy to be a part of this and happy to see these be so successful. And congratulations on the marathon of webinars that you have had and reaching your last one for the week. So you guys really did a great job, and we're happy to be a part of it. So again, as Josh said, my name is Roxanne O'Connor. I'm the Support Services Senior Administrator for Department of Family Services. Childcare licensing falls under the purview of support services, and that's why I'm here speaking to you today. On your screen, you can see a number of the requirements that have been put in place as a result of the modifications of Order Number 1 for childcare facilities, which has gone into effect today. Again, a very exciting day for Wyoming to be able to relax some of these provisions. It might be a little bit difficult for you to see these requirements, We have sent them out to all childcare providers that we have on our e-blast list. If you are a childcare provider and you didn't receive them, or if you're just a member of the community and you want to receive them, please don't hesitate to reach out to me and we will get you added to our childcare provider distribution list, or I'm happy to just provide the information if it's something, if you're interested as a parent or another community partner. So don't hesitate to reach out. Warren, if you wouldn't mind adding my email address again to the chat session, that would be really helpful. Thank you. A couple of things in regards to these requirements. We've had a question about the first requirement where we have groups of 9 people or fewer. We've been asked if that includes a staff person or 2, or if it's just children. And it is a combined 9. So you want to include children and staff, people in general in that group of 9. So we hope that that helps provide some clarification. Also, please keep in mind that not only do you have these requirements that need to be adhered to when you open your childcare facility, we also still have our regular childcare licensing requirements in place. So if you have questions on how to manage those, how to balance the two, how to incorporate these new ones into your facility or into your home, please don't hesitate to reach out to your licensor. Through all of this, we've created some great connections, especially through our public health officers. Our licensors have been in constant communication and contact with them, and they've been wonderful partners. So if you have questions, we can help field those questions. We may not be able to answer them as it relates to the order, but we're happy to pass them along. When you ask questions, we also learn, so it's helpful for us to be able to provide additional information when duplicate questions come up. So please don't hesitate to reach out. Another great resource for facilities that are just now opening would be facilities that have stayed open. We had about 45% capacity during all of the closures, where we had childcare facilities who were operating, who were serving essential personnel and really serving an essential function for many community members across the state. And so through the last 5 or 6 weeks, they've been able to become very innovative. They have some lessons learned from how they've been able to stay open during this time. So I would say, please lean on your fellow community members, your fellow facilities, your fellow childcare providers to kind of learn some tips and tricks on how to make this work for your business, make this work for your families, for our children, so that everybody can remain safe, both financially and from a health perspective as well. Josh highlighted the website that they have available that really shows some of the businesses that are open and are available for business. We at DFS, if you're a childcare provider, you know that licensors have reached out to you to see what your status is in regards to whether your business is open, how many children you're serving, if you have slots available. So we have that listed on our DFS website. So if you're a parent or if you're trying to find another childcare facility that's open to learn from them, please visit our website and you can be able to quickly identify which ones are open and also have slots available for children if need be. Let's see here. I want to make sure I cover all of my points. Another question that we've had come up in these sessions is, how do you prioritize essential personnel over just other families that are needing childcare? And essentially, essential personnel get first priority if they've been enrolled in your facility. So if you're opening and you have children of essential personnel, they should be the ones that receive the slots that you have available first. If you have other families or clients that were already enrolled in your facility, they should essentially be your second priority or your second group that you can serve. You don't have to, if an essential personnel comes to you and they were not a part of your facility before and asks if you have a slot available, you don't need to make a slot for them if you're serving some of your prior clients or clients that aren't necessarily considered essential functions. So we wanted to provide some clarification on that. We are going to be developing through these sessions an FAQ that we'll be posting on our website as well. So if you weren't able to attend all of these sessions, or if you just wanted to see what we discussed, we're going to be taking the childcare portion of these questions, providing them in an FAQ on our website so that you have a one-stop shop to be able to answer any questions that may have come up here. So again, I would just emphasize that please lean on your licensor, please lean on your public health officer as you come about inevitably some questions. All of this is going to be a little bit of a gray area for everybody. Certainly we haven't thought of every scenario that could occur, but there are resources out there for you. We're ready. We want to help. We want to see everybody be successful, and we want to see Wyoming come out of this stronger and better than ever. Thanks, Josh. Yeah,
thank you, Roxanne. And we did paste those links in the webinar chat to both the DFS's main page as well as the link that goes directly to that map of daycare facilities. So thank you for mentioning those. I think that's a really, really key component to make sure that we share information and answer those questions in an FAQ as well. So thank you for that. Now we're going to jump to the next one. And quite frankly, I think Stefan will agree, this one has sort of been the star of the show over the last few webinars. And it's one that people pay a lot of attention to. And while there aren't many, major changes to it, we did want to address some of the logic behind this and how we came about to this spot. So Stefan, can you go ahead and walk through that, please?
Sure, Josh, thank you. So when it comes to order number 1, which put restrictions in place or closed various types of businesses, the changes for May 1st for today, specific to restaurants and dining, are relatively minor. And you may have noticed that in the orders or the announcements in media you saw or heard about the orders. So I won't bury the lead. I'll just let you know that the big change or minor change for restaurants and dining under order number 1 is that customers are now allowed to go into the restaurant 5 at a time to pick up food or beverage orders. And unfortunately, that's not great news for all of you, but that's the big change for order number 1 specific to restaurants and dining. As Josh said, I wanted to give you all kind of a sense of the logic behind what we're doing with these orders. And then I'll talk a little bit about the exception request and variance process, but we'll touch on that more at the end of this webinar. But the logic behind putting orders number 1, 2, and 3 in place, as you may have noticed, was really first and foremost order number 1 to put restrictions and closures of certain types of businesses or entities that solicit larger gatherings of people. And the reason for that is we just, like I mentioned before, we just don't know a whole lot about COVID-19. That's the reason it's called a novel coronavirus. It's new. The data and the evidence and the science will keep coming in day by day, week by week, and month by month. But what we do know about COVID-19 as a respiratory illness is that one of the biggest contributors to its spread is groups of people, especially larger groups of people, where we really see outbreaks happen. And that's where the social distancing comes from. And so order number 1 was really an attempt to put restrictions and guidelines and closures in place that limited businesses or entities that solicit larger gatherings of people. Order number 2 was really a kind of an extension of that, but for public events. So that's where you see, a prohibition on the gatherings of 10 people or more. So think of public events, conventions, sporting events, etc. But again, tied pretty much to what we know about the virus, which is groups of people and larger groups of people really do contribute to the spread. And that's what we've seen in countries and other states that have been really hard hit by this virus. And then order number 3, as you know, was really directed at those personal care services that may not solicit large gatherings of people, but represent sort of high touch services that have more of a unique public health impact when it comes to virus transmission. When it comes to relaxing these orders, we're kind of going in reverse order, for lack of a better term, where we still know that larger groups of people will be contributing to more of the virus's spread. So that's why you see order 3 as opposed to order number 1, with the exception of gyms. Order number 3 really being relaxed first, because that's easier to control in those personal care services with one-on-one, not a lot of people in the building or in the establishment, distancing between stations and between people, and some of the things that we'll talk about a little bit more here in a little bit when it comes to order 3. But I wanted you all to know sort of the Department of Health and the public health logic of how we're looking and what the timeline is that we're looking to relax and ease restrictions, so that you don't think that we're just completely shooting from the hip on these decisions. But again, I'll just reinforce that it's difficult to make decisions with limited data and limited evidence. So we're really trying to balance, as Josh put it, the livelihoods of people in Wyoming. And we know there's not an hour that goes by that we don't think of the economic and business implications of this whole crisis, but balancing that livelihood with the lives of people. So with over 400 cases and 7 deaths, even though relatively speaking it's low compared to some other states and the rest of the country, those 7 people who have died are our neighbors, our friends, people who in 1 or 2 cases operated or owned businesses. And so it is a serious thing to consider, but wanted you guys to have some of the logic behind our decision making on relaxing restrictions within these orders. But again, just to conclude on this slide, the big change for restaurants is to allow 5 people to enter the establishment and pick up food or beverage orders. And we'll talk here in a little bit, here in a few minutes, about the process for exception requests and variances, where this could potentially change a little bit, even starting now and in the days and weeks to come. Thank you, Josh.
Yeah, thanks, Stefan. Really appreciate that. And just to as we jump forward to gyms and fitness centers here, I wanted to mention that while you may not be able to see the text on your screen for some of these slides, because it is rather small and we're not necessarily reading it word for word, these slides will be available after the webinar. The orders and links to those orders will also be available at the end of this particular slideshow, so you'll be able to see those. And again, we really recommend that you take a close look at those and make sure that you are meeting them. And if you do meet them, if you meet these guidelines, you do not have to do anything special to open your business today. Your ability to open up is within these guidelines is on you, and you can do that now. And you don't need to ask specific permission from your county health officer or the state health office as well. So meeting these conditions is all you really need to do. So speaking of that, I'll discuss some of the gym and fitness center things, and rather than reading each of these down the line, I will touch on a few key components of this list. And the first thing that raises a few questions has to do with management ensuring on a daily basis that employees who present symptoms will not be permitted. And one of the things that somebody asked was, well, what are these symptoms? And so the Department of Health has put together a list and a link with all of these, the symptoms that you should be watching out for on their website. And again, that link is available at the end of this presentation. One of the things that we wanted to highlight is that there are no close contact activities, including one-on-one training or weightlifting that requires a spotter. And so making sure you have that distance between you and others is key. Locker rooms, I believe, because the difficulty of cleaning and also making sure that no congregation occurs, locker rooms must remain closed. Keeping that workout equipment spaced apart and then cleaned by a member of the staff in between customers is also critical. And so that is a key component. And then I think this one has probably been the one that causes the most concern or questions, has to do with the workout classes being prohibited. So group workout classes are prohibited, which can be challenging for some gyms and some services, as I'm sure many of you are aware. but we want to make sure that you pay attention to the exception process and the variance process on the next couple slides, because I think what we're seeing here is that it's challenging to make rules that apply to everyone, and the nuances of your business or your particular fitness or group classes can be kind of challenging. And so again, that group, the groups getting together and having the spread, as Stefan mentioned, that's the big challenge with the coronavirus. So that was the reasoning for that. But we do realize that many of you have a way to ensure that distancing and ensure that your group classes don't share equipment and things like that. So that's where that exception process can definitely come in handy. You'll want to take a look at the spacing requirements there, and then just a quick heads up on swimming pools, 1 swimmer per lane, and then spas and saunas must remain closed. So with that, we'll jump, and I know we do have some questions that we can handle toward the end on the fitness centers as well. So thanks for bringing those to our attention. Now we'll jump into order number 3, and to talk about that, we have Sharon Bennett from the Board of Cosmetology. Sharon, let's take a look at that.
Good afternoon. Thank you guys again for doing this. And yes, this is an exciting day for us. We've got people open. I was running some errands earlier and I saw barbershops and salons open, and we know that that's just very good news for a lot of people. We're wishing them the best. As we move forward with this, we have all of these orders on our webpage. We have other information that we think could be helpful. We have linked the guidelines for screening from the health department. And if there is something out there that, or there's a question that is not answered, we're here to take any calls. If we can't answer a question, we will work with the folks at the health department to find those answers. I did want to say one thing. Across the state, we know that we have a lot of people that are not necessarily computer people. So if you are one of those, or you know somebody that is, please have them call us. We would be happy to send this to them by regular mail. We have packets ready. If you're kind of taking this slow and want to think about opening for a while, we still have plenty of time to get you that information, or would be happy just to go over it with you on the phone. So we just want to make sure that everybody that needs this is getting it. I don't really have anything new to add to these orders. If anybody has any questions at the end, I'd be happy to answer them. We're just wishing everybody the best. And as we start opening, and it's exciting to get open, but we just really want everybody to remember that public health and safety and our licensees' health and safety and our families just has to be our #1 concern as we move forward through all of this information. And thanks again for putting these on.
Yeah, you bet, Sharon, and thank you. And I know that many folks around the state are going to be looking much better after today. I'm sure that that haircuts and nails and things like that are going to be done, and that's fantastic. So thank you and your board for being willing to help out so much and provide this information, and also working with your licensees to get them the information they need and make sure that they open up safely. So thanks, Sharon. All right, well, let's jump into the variance or exception request, and really, again, as we developed these guidelines and with the businesses, we talked with a number of businesses around the state as well as organizations to come up with guidelines that made sense, and then working closely with the Department of Health to come up with guidelines that meet that public health need first and then business second. We were able to do this. We realize that putting out state orders can be pretty challenging, and it definitely doesn't meet all of the nuances and the specifics of your particular business, where you may be able to ensure that safety just as easily as someone who meets these guidelines and you don't technically meet them. So having that ability to do an exception or a variance is key. One thing I will say is that keep in mind that there are many different counties in Wyoming, and Stefan's going to go through the process and he'll hit on this again, but there are 23 counties in Wyoming. There are many, many businesses in Wyoming and in your county. And so burying the county health officer with a number of exception requests may not be the best strategy. However, working with maybe some of the other businesses in your town that offer similar services might be a way to get a countywide variance. Again, not going to speak for any counties and their health organizations on how that will be determined, but you might want to think about the ability of getting a countywide variance by grouping a number of businesses together and going to the county health officer as one, if you can. If not, the exception process will be laid out here by Stefan, and talk a little bit about that and how that works. Stefan?
Sure, thank you, Josh. And I was furiously typing and trying to answer a number of questions in the Q&A box. So really great questions and great feedback, and hopefully I was able to provide some clarity. But this is a good opportunity based on some of those questions to talk about what the countywide variance and exception request processes look like. I want to draw a quick distinction between what a variance order is versus an exception request. And I know the legal language and the legalese of this whole process can be very frustrating, but this should clarify at least some of the questions that I saw in the Q&A. So on a countywide variance order, that's really a replacement on a countywide basis for one of the public health orders that is in place from the state. So when you think of one of the elements that's in, let's say, order number 1 for restaurants, for example, if a county health officer, based on feedback or requests or what have you, was receiving a lot of requests for exceptions on outdoor seating, for example, there is a process to request a countywide variance order where a new order would be put in place for that particular county that would allow, in this hypothetical, outdoor seating for restaurants. So that's what's known as a countywide variance order, and would apply to those businesses that would be, changing what's in the statewide order. It would apply on a countywide basis. The other process that folks on this webinar might be interested in is the exception request process. And that's really where a specific business, an entity, or a group of businesses or entities could request exceptions to specific provisions that are in the state's statewide public health orders. So they're kind of similar, but pretty distinct in how they would be applied. An exception request would be specific, again, to that business or group of businesses that would be be named essentially as allowed to operate under as an exception to the statewide health order, where a countywide variance would be a new order, either more restrictive or less restrictive, that would apply to the entire county. So it's an important distinction to make. And I do want to mention, before I talk about the process, that since this week, when the new orders were announced and we knew they were going to take effect on May 1st, and we have communicated about this variance and exception request process, there are a number of variances that are being considered right now, both at the county level and at the state level. So the process is working, but as Josh mentioned, we're going to monitor the volume going forward to particularly be sensitive to the workload for our county health officers and our state health officer, where we don't want 100,000 exception requests coming in, where potentially a variance order might be more efficient. So we'll see how that process evolves over the coming days as we consider some of these variances and exception requests that are being proposed. But the process that you see on your screen is pretty much the same, with a few exceptions, between countywide variance orders and exception requests. And where it really starts is local discussion on either the variance proposal or the exception request. So we want local partners at the county level, so the county health officer, county commissioners, law enforcement, county attorneys, to discuss this and hopefully be on the same page with either an exception that's being sought or a variance that's being proposed. That we think that buy-in is really crucial, so that we don't have a lot of cooks in the kitchen with differing opinions. We want this to be kind of local buy-in on a variance or an exception that's being sought. Secondly, the county health officer will be kind of the gatekeeper on those proposals for exception requests. And if there's any planning documents from a specific business or guidelines that a business is saying, here's how we will follow social distancing, here's how we plan to modify our physical plant or our facility, the county health officer can consider those planning documents in the proposal for an exception request. And then third, the county health officer, again, is kind of the gatekeeper, approves or denies the request. If it's an exception request, then that goes directly to the business or the entity that's seeking the exception. And fourth, if it's something that the county health officer would approve, whether that's a variance order for the whole county or a specific exception for a business or an entity, then that county health officer will discuss with our state health officer and basically submit it to the state health officer. The state health officer then consults with the attorney general, and we're getting close to the end of this process, but after consultation with the attorney general, can ultimately approve or deny the variance order or the exception request. So like I mentioned, this process is underway right now. I know there's a couple of variances that are being considered, a couple of exceptions that are being considered at the county and at the state level, but wanted to let everybody know that this process is there. We don't want a run on the bank, so to speak, with like I mentioned, thousands and thousands of exception requests being sought. So I think that local communication, like I mentioned in step one, and like Josh mentioned among yourselves, is really important. So if there's a group of businesses that think that they would want a similar exception request, then it's worth discussing that with your colleagues and with your peers and with your county partners to see if an exception request could apply to many of you. And if that's the case, maybe a variance order would be more appropriate. So again, we understand these processes are not perfect. We're going to have to work through the details and iron out some wrinkles in the process. But these variance and exception requests have been in the orders since we started. But I think we're at a point now, depending on the county and depending on the data, where these exceptions and these variances can be considered more seriously at this point. Thank you, Josh.
Yeah, thanks, Stefan, for walking through that. And we do have a couple questions that popped up, and I think we can take these on. I think first and foremost, there's a question from Suzanne. So I guess just to follow up with everyone, the question and answer portion of this, you have a couple different options. You can raise your hand and we can have you ask your question live, or you can type it into the Q&A section, and we will do our best to answer it at from now until the time of the webinar is over. We do have a few that are just started out, and please don't hesitate to ask those questions. The first one comes from Suzanne. It says, will you address dental offices / visits? Stefan, I don't know if you have any information on dental offices and whether they're open or not.
Sure, I do. Sorry, I was trying to unmute myself, but the ape was not getting the banana in that case. So I do have some information there for the question. It's a good question from Suzanne. Dental offices and other healthcare providers and facilities, were not closed by public health orders. There were guidelines that were put out both for hospitals and other healthcare providers to minimize the use of PPE. So a lot of your elective procedures and non-emergency services were suspended. Many providers did that, and dental offices are a unique example of many that decided to close or suspend services because of the concern or risk when it comes to spreading the virus. But I would say, Suzanne, that's a conversation to have with your legal counsel and with your insurance carriers. There's nothing specifically that's closing dental services right now, but I know it's been a business by business decision on what's best for that particular operation. So not a great answer to your question, but there's nothing specifically on the state side that has closed dental offices.
So essentially, Stefan, if I can make sure I understand this as well, dentist offices that did closed really based on their own choices, not a state order.
Yeah, I think, Josh, that's a good way to put it. But I would say that, dental offices and other businesses that did the same, I think making those decisions was important. And even though it might not have been specific in an order, I think keeping everyone's safety, both staff and patients, in mind was certainly appreciated on the Department of Health side. But yeah, that's a fair way to put it, Josh.
Okay, absolutely. Thank you. Thank you. Let's see. So if a business or group of businesses, this question comes from Gustav. If a business or group of businesses request a variance or exception that gets denied, does the county or state health officer have a requirement to provide reasons and data behind the decision?
Yeah, Gustav, that's a great question. I would say nothing in legal black and white that orders a process of how county health officers have to justify a decision. But I would say, as far as I know, county health officers, as much as they can, are working with their local partners to indicate, what is driving their decision. So the blunt answer to your question is there's nothing legally binding for a county office to have to justify, an approval or denial. But I would say that when it comes to what our county health officers and the state are observing in our counties, and it's not perfect. The data is limited. We're trying to be data driven, but everybody's getting frustrated with that term because we just have limited data and we have limited testing. So we just don't know a whole lot. And it comes down to those high level metrics that I mentioned to see if we're willing and if our county partners are willing to take on more risk. So again, blunt answer to your question, Gustav, is there's nothing in the orders that legally requires any sort of process for answering those questions, but we're relatively confident that our counties will communicate with entities that are making those requests to the best extent possible, again, depending on the volume of the requests that come in.
Yeah, and I think there's a real desire for everybody to work collaboratively and people, making sure that it's an open conversation. And I hope that is that carries forth to all of those counties. But I know that is definitely, as you can see from this webinar today and the data that's being presented on the state site, that is based on. That's our goal, is to be as open and clear as possible. So a couple other questions came out. Let's see. So this one actually comes from Mr. or Mrs. Anonymous Attendee, but alas, it's a good question, and I think we want to address it here. I think we can. Do we have any end date in mind that will be just begin opening up all businesses with the sanitizing and social distancing recommendation? I think that's kind of question one. Stefan, I'm guessing you're going to say it's probably not, there's not a date necessarily, but it is based on those guidelines and the metrics that we're tracking. Is that correct?
Right. I think there's a frustration if I said, hey, we're just going to be data driven, and that's not a good answer. So that's not the answer I'd like to give. There is no specific date that we're working backwards from, but I will say these orders, the continued orders, numbers 1, 2, and 3, they're in place until May 15th. So the date that we have right now for this current process is until May 15th. And again, that's where the variances and the exceptions are coming into play and are being considered right now to either further ease restrictions that are in the orders. And I'm just saying it's possible, we haven't seen any yet, but there are counties who may propose to be more restrictive. And it's important to know that could happen depending on what we see with the virus. But there's no specific date that we're working backwards from to say, all businesses we're going to open everything on May 15th. But the orders do expire on May 15th. So we're revisiting those decisions on a daily basis, but no hard and fast timeline. We wish, like I mentioned at the beginning of this webinar, our timeline is yesterday. We understand the economic and business impact of these decisions. And frankly, we understand very well the health impacts from economic downturns. Those are very real, but we're trying to balance what Wyoming has done a pretty good job with relative to other states, the spread of this virus with the livelihoods of our residents and the economy and our business community. So I know I'm probably the skunk at the picnic today to give you that answer, but it is a tough balance to strike, and we just really appreciate our business community's understanding and flexibility with some of these tough decisions that Department of Health and the governor, frankly, have had to make.
Yeah, and Stefan, there's a second portion of that, and it had to do with kind of saying, hey, if I can meet the same standards of social distancing and sanitization and those kinds of things, how can I open up? And I think the exception process is exactly where that should be taken. So, if you're able to show that. That would be a case where asking for an exception or a variance is absolutely the course of action there. So great question, and thanks for asking it. We sure appreciate it. We do have a couple other questions that popped in, and it looks like the timing is going to be just about right. But of course, we will do our best to answer all of them if you can. So don't feel like you can't ask one if you have one. This one comes from Nikki, and it is what kind of guidelines are there for retail shops looking to reopen? And yeah. Nikki, Stefan, I might take a stab at that one if you don't mind. I think that this question came up a few times, and it has to do with retail shops and whether they closed or not. I think the orders are a little tricky, but they do say that not necessarily retail shops had to close. So depending on the kind of business you are, but I think the reopening guidelines, you might want to take a look. There aren't any necessarily, Stefan, if I'm correct, there's some things in the order that talk about best practices and guidelines that you should do about social distancing and that. But I think you should also take a look at some of these websites and resources that are out there, like Reopen Main Street. It may have some really good, not just public safety types of things, but also marketing advice for you as well. I think you need to look at it from both perspectives. So from a marketing perspective, making sure you're talking with your customers, making sure you're ensuring that they're going to be safe, because there's going to be, even if you're open, there is going to be a reticence to shop for many of these customers. And so our Main Street program is actually going to put out some guidance on shopping safe and making sure that your customers feel comfortable coming into your store and what you should do to that. So stay tuned for some more information on that. And then Stefan, do you want to touch on any kind of guidelines that the Department of Health might have there as well?
Sure, I did. Thanks, Josh. It's a great question. I did in the Q&A box, I did send over a link. It's pretty general, and it's from a health perspective, but we do have guidance out there for grocers and retailers that might be open or might be wanting to remain open, of some different precautions that can be taken with regards to some social distancing, some volume limitations, but also we link to some signage and some posters that the CDC makes available, as well as some resources on the state's COVID-19 page. So I know it's general, it's just a quick one-pager, but that might help for any retail businesses that are looking to either continue services or to reopen during this outbreak. Great, thank you,
Stefan. And actually that concludes the question and answer portion. Actually, we did just get one more in right at the end here. It says, what about a game store and groups, no more than 9 people at a time, I assume? So I'm guessing this is a retail business that is wondering about the limitations on the number of people in that store.
So 2 things. If it's retail, then there's nothing specifically closing retailers, but when I hear game store or groups, I'm thinking maybe card players or things like that, where it is important to consider order number 2, which limits gatherings of 10 people or more. So my initial answer to the question, and I believe it was Jacine, would be to take order number 2 into consideration with your particular business on limiting the volume of folks that you have, either in the the game room or the game store, or in a confined space within that business. And talk to your county health office, your county public health office, on any questions of order interpretation or enforcement. They'll be a good resource to you to let you know where you fit in any one of the 3 orders. But it sounds like with that limited information, it might be order number 2 on gatherings of people.
Great, thank you. And thank you all for the questions today. More than anything, I do want to thank all of the business owners and community members who have attended these webinars over the last 3 days. We had over 550 attendees during this time, and I think that's great to try to understand these orders, how they impact you, and how you can work with them in order to keep your business going throughout this process, as well as keeping your community safe. And I really want to thank Stefan, Sharon, Roxanne, and Warren for putting on such a great series of webinars. Having that collaboration is important, and having people be able to reach out and talk with the experts is critical. And so, at the Business Council, we definitely want to help businesses through this particular very, very challenging time. We know that this is a time that is frustrating and challenging on many levels, and we want to be here with information that we can provide and help you through as much as possible. We realize that sometimes we're not able to give you the answer you want, and we really wish we could. However, we do have to balance that whole lives and livelihood. That balancing act is important. And so making sure that you continue to be creative and collaborate with the other businesses within your town and your state, and reach out and try to get assistance when you can. Please let us know if there is information that we can provide as the Business Council to keep you moving through this. And we just want to let you know that we really appreciate the Wyomingite spirit of resilience and patience and compassion throughout this time. And we feel like eventually it will come out stronger, and our businesses will be better off because of these challenges. And we just want to thank you again for your time today, and have a great weekend.